Assalamu alaikum. Welcome to today's episode of Talking Point. I'm your host, Syed Neaz Ahmad. In our studios today, we have a guest who is a doctor by profession. She is a consultant at Royal London and Barts Health. She is Dr. Nashaba Matin. She studied medicine at Imperial College and she received her medical training in London. Her postgraduate specialist training was in public health medicine and HIV medicine. Her main area of interest is international health and HIV health care. I'm always amused by terminologies like public health and international health. That I will definitely ask her later. But welcome to the show, Doctor.
Thank you very much. It's a pleasure to be here.
Thank you for making time for us. I know that you are busy.
Thank you.
Particularly at the beginning of the weekend with commitments everywhere, and that you waded through London traffic on a Friday afternoon.
Very welcome. Thank you for inviting me.
Not at all. You are welcome. And you are a welcome addition to the show. As a consultant physician and as a medical professional, we'll talk. We have got topics and subjects and questions for you. But first of all, I would like to know, where did it all begin? Your journey into the science of medicine and the science of HIV. How did you become interested in medicine first?
So that's a good question. I think it's a very common question we get asked when we apply for medical school as well.
Yep.
So I think, if I'm honest, for me, I've wanted to be a doctor ever since I was about 4 years old. It's the only thing I ever wanted to do, probably because my mother was unwell at the time and in hospital. And so seeing the nurses and doctors caring for her, I think, was one of my earliest memories.
It was a noble profession.
Yes, very much so. So it's something I always wanted to do. And that interest and that drive never left me.
Yep.
And now, having qualified more than 15 years ago, I still think it's the best decision I ever made.
Right.
Yeah.
But what made you specialize in HIV?
So I think for me, because of my background and obviously when you are born in one country but you have a family and a cultural root in another country, you always have a much more global sense of the world.
Right.
And I was fortunate as a child to travel frequently to Bangladesh, so I very much saw that the world is very different in different places and healthcare is very different in different places. So for me, it was always an area of real fascination is, well, why is healthcare delivered differently in different places? And why is it that, that the health challenges that are faced are so varied across the world? So for me, infectious diseases has always been an interest of mine. And for me, HIV especially, probably because it really does have a disproportionate impact and burden on women and on children.
Well, HIV has been there for all this time, isn't it? But it came to the scene, I think, about maybe 25, 30 years ago.
Yes, that's right. Yep. In the 80s is really when it was first came onto the scene, and they had the first case that was detected in the States.
I think all the diseases have been there, and all the probably the cures are there, but we yet need to discover them.
Yes, that's true. So I think HIV actually was present but not detected for some time before that, and there is some data to show that it originated probably in macaque monkeys and then was transmitted and jumped across to the human race.
Is that right, you think?
Yeah, I think that's the data that we have, and that there is some evidence that would support that it was essentially the sort of bushmeat trade, killing animals which are wild in the jungle and eating them, and at some point the virus was able to mutate and jump into the human beings, and then from there it spread. In terms of cure, so I think for some...
No, that was just a passing reference to diseases and cures. See, they're always there, see. I didn't mean to ask you that question so early in the program, see, but definitely we'll arrive there.
Yeah.
Yes, definitely.
Great.
We were talking about, you said that why it came to your mind, why the different healthcare systems and different healthcare facilities in different countries.
Yes.
And you kept going to Dhaka with your families,
Yes.
probably on holidays.
Yes, that's right, yes.
But in 2010, you went to Dhaka on some sort of assignment, isn't it?
Yes, that's right. So I think that I always wanted at some point to work in a more official capacity in Bangladesh.
Right.
Partly because it's my interest, but also, if I'm honest, partly in terms of serving my roots and
Right.
my family, and this is where my roots are from. Even though I was born here, I've always felt a very close link to Bangladesh.
What is ICDDR?
ICDDRB.
Yeah.
So it's the cholera hospital in Mohakali in Dhaka.
Oh, yes,
Yeah.
yes, yes.
So it stands for International Center for Diarrheal Diseases Research,
It used
Bangladesh.
to be some sort of cholera research center or
Still
something.
is. It still is, and it's one of the premier centers in the world.
Right. See, that's
Yes.
where you worked.
Yes, that's where I worked. Yeah.
Uh-huh.
Yeah. So predominantly they deal with diarrheal diseases, malnutrition, TB, enteric infections. But at that point they also had opened an HIV ward for patients to provide service and care. And they had a team of nurses and doctors, but really they needed somebody with much more specialist training and knowledge to essentially train the team up and to develop the unit
But
further.
just one question there. What had motivated you in 2010 to go to Dhaka to do this?
As I said, I think it was always an ambition of mine to go back and, well, not so much go back, but for me to go to Bangladesh
Right,
and
I see.
essentially to
It was
serve.
for several years, isn't it?
I went for 2 years, yeah, yeah. So it was an ambition of mine to go and to serve and to train and to teach, because training and teaching for me is a passion, actually, because if you don't teach and you don't train,
Teach, and also treat.
yes, absolutely. But anybody, if you teach your team well, they can always treat. But if you're the only one that can treat,
Yeah.
then when you go, there's
Yeah,
no
yes,
sustainability.
It's like teaching the technology.
Yeah.
And but did you find that the infrastructure was there for you to operate and to teach them and to show them the ropes, how to go around?
So Bangladesh is a very different setup to here. The infrastructure is very different. On some levels it's lacking, on other levels it's more developed. So it's a very different way of working there, and it's more challenging in some ways. And also medical education in Bangladesh, I still think, is developing. And so the methods of teaching...
You mean the teaching at colleges?
Yes, teaching at colleges and the way that they train their doctors who are post-qualification, postgraduate training.
Most of the teachers and professors there, they have been trained abroad, isn't it?
Yes, so you will be
one
trained...
would expect them to do better
Good
and
point.
probably carry
Absolutely.
on the same sort of system that they went
Yes.
through.
Well, that's a very good point, actually. So you can be trained abroad in your clinical specialty to be a better doctor.
Right.
But actually, medical education in itself
Right.
is a skill, and it is a science of its own. So that's where there is still a gap. And so, but for me, it's very interesting for me going there and training and teaching in the way that I know from here, and getting some really positive feedback from my colleagues and my juniors, saying that they'd never experienced teaching in that setting before,
Where
or
did
with
you
that
teach?
forum.
At
I taught in every opportunity I got. I taught by the bedside, on the ward round, in the meetings. We used to have formal training courses, both in-house and inviting external doctors to come in. We used to do conference feedback meetings. Every opportunity for me, every contact I had with a fellow professional, be it a doctor or a nurse, was an opportunity to teach.
Did you teach in a classroom situation?
Yep, classroom. But interestingly, that was actually what everybody expected, was for me to just go into a lecture theatre or a classroom and teach. But what I actually pointed out is that also I needed to bring them into the ward and teach them at the bedside with the patient. Because one of the biggest problems in Bangladesh was the stigma and the fear of HIV. So however much I said in the classroom, you don't have to be scared to touch the patient or to examine the patient.
That's a very good point. See, I just wanted to know because a lot of people are watching us throughout the country and also abroad. Everybody knows what is HIV. You see, what is HIV? HIV. You see, but what is really HIV?
So it stands for human immunodeficiency virus.
Yep.
So it's actually a viral infection. The virus enters the body. It enters the white blood cells, which are the cells that we need to fight infection.
Right. Any particular reason one should be careful while doing something, eating something, and mixing with people?
Yeah, that's a very good question. So we know now absolutely for sure that you cannot get HIV by sitting next to somebody, eating food from the same
Traveling
plate.
on the train.
No, absolutely not. You cannot. You cannot get it. The only way that you can get HIV is essentially from sexual contact with somebody who has HIV. If you share needles or injecting equipment or have a blood transfusion from someone who
Not
is
sharing the food.
infected. No, not sharing the food. And the third way is from mother to child during delivery and from breastfeeding. So those are the only ways that you can get HIV, and there is no other way. So sharing food, sitting on a train, hugging somebody, kissing somebody, all of those are absolutely fine. Yeah.
We often wonder, see, I mean, look, like people, say, oh, I'm not sure, I've been traveling on buses, and so I'm not sure how many ailments I have contracted.
Yeah.
So.
Yes, well, that's a good point. They probably have come into contact with many ailments, usually the flu virus and all the coughs and colds, but not with HIV, no.
Not HIV,
no,
yes.
no.
Because it's very satisfying for people to know that this is the only way one can.
Yes.
And if I avoid that, I'm safe.
Absolutely, yeah.
What are the stages that if one people get it, see, is there a cure, or is there a kind of can it delayed that one can, like people say, there's no cure for cancer, see. But then again, there are people who survive.
True, actually.
Who survive for longer than the other persons.
Yeah, absolutely. So, with HIV, you're right. So if you think about the natural history of infection, so you can get HIV, and then you can remain totally well, with no symptoms, and be absolutely fine, going to work, feeling normal.
What are the symptoms?
Well, so you can feel absolutely fine with no symptoms for a number of years. And eventually, you may start to feel unwell. You may start to feel fatigued, tired.
Okay, Dr. Nashaba, we need to take a break. And then when we come back, we'll continue with this. We'll pick up the thread, inshallah. Okay. Thank you for being with us. It's about time we take a break, and then when we come back, we'll still be here talking to you. Don't go away.